Okay, machine won't start. So, really? I like to see that. Okay.
What do we do? Yeah.
So you give it to the patient. Okay, take a deep breath. Okay, I set my 15, right? I set everything. Take a deep breath. Take a deep breath. Geez, what's going on? And I've seen students do this. I'm like, how come it's not going? I don't know why it's not going. Duh. Okay. So you plug it in. You pull that immediately, so it stops. Okay. Now, if I make it too insensitive for him, and he's trying, and it's not going, and you have a little old Nana Tata who's just too weak, it's not going, right? So what's the other thing that you notice here? Second?
It's all the way to the red.
Okay. It's moving, it's plugged in, but it's moving, so it's not sensitive enough. Its sensitivity is too low. Okay, it's not sensitive enough. So you need to adjust the sensitivity so it starts. Okay, try that. There you go. Okay, that's the first one. Machine won't start. Second one, large negative pressure swings at early inspiration, right at the beginning of inspiration. Sensitivity again is too low. So, I have it here. Okay, go ahead. So it starts, but what do you notice? It's beyond -2. Okay, in the peach-colored area, pink-colored area. That means it's too low. It may start and it may work, but what's going to happen to him eventually? He gets tired because he's having to suck in too deep or too hard to actually start the machine. It can stop. Large negative pressure swings after is different, meaning this is set properly. You see -1, -2, but the flow, let's say I put it on 7 here. Go ahead. Okay. So large negative pressure swings after the machine turns on. Okay, go ahead.
Oh, it's disconnected.
Oh, my boobie. The non-boobie. Okay, go ahead. Oh, you're not dumb. You're a little too strong. So what's happening here? We can't imitate it because he has normal lungs. Is it's -1 or -2, but then it starts and then it swings back. Okay. So for someone who is too weak, try that again. Try. Yeah, we can't imitate it with him. Okay. So for someone who is a little bit too weak, you can see that it starts at -1, -2. It starts and then it goes back into the negative side, and then it goes up. And so that what you're doing is the breath starts, but the patient is trying to suck in because the flow is not enough. Okay. That's the difference between those two. One is right at the beginning, one it starts and then it swings back. Okay.
Oh no, it is.
Did you do it?
Oh, it was.
Okay, do it again. Yeah, just like that. But it swings more actually, even worse. So that means the flow is inadequate. What do you need to do then? You need to turn up the flow. Or the patient is actively inhaling. So, like that. No, a little bit more than that. Like that. He's actively inhaling. You have large negative pressure swings when it starts. So remember, he has to relax. Let the machine just fill the lungs up. If he's actively inhaling and assisting it, not good. So it just sucks back in. Premature cycling off. The flow is too high. Go ahead. There we go. It stops because what happens? What does this control again? What does the flow control? Eye time.
Eye time.
Right. So if the flow's too high, your eye time is too short. It's opposite. Okay. So if you turn it up too high, your eye time is what? About not a second, definitely. So it hits the pressure so fast. So that's the flow is too high. Okay. The other one is if there's airflow obstruction. Your flow is okay, but he sticks his tongue in it. Don't be like my 3-year-old. Okay, he sticks his tongue in it. No, I want to kiss. Okay, I did that once with her. Okay, so airflow obstruction because of the tongue. He sticks his tongue, it reaches the pressure so fast it stops the breath. Or he doesn't stick his tongue, but he goes, it's all in the cheeks. There you go. Okay, so it doesn't go in the lungs, it's going in the cheeks. So it stops the breath. Okay, reaches the pressure. Or the pressure is too low. If I turn this down, go ahead. It's reaching it immediately. For someone who has, his lungs are normal. His lungs are compliant. And so you only need so much pressure, maybe at 10 or 5 to inflate the lungs. But someone who has, let's say, pneumonia and with atelectasis, you can go up to a pressure of 25 and not get volume. Okay, so if your pressure is 15 for a patient who has pneumonia, really stiff lungs with atelectasis, it's going to hit that because the lungs are so stiff and non-compliant. Pressure is going to hit that the needle's going to hit that pressure immediately, and the lungs haven't expanded yet. Does that make sense? It's too stiff that it's just going like this. But for his lungs, just a little positive pressure and it opens up. So you gotta, in sick patients, it's much, much higher pressures. So if your pressure is too low, it would cut off immediately for someone who has very stiff lungs. Next one, that's premature cycling. Auto-triggering is, so too sensitive, what happened? Okay, put it in your mouth. Just leave it in your mouth. No, and breathe. Are you even breathing in?
A little bit.
He's not even, if you look at his chest, he's not even taking a breath. There you go. Okay. He's not breathing in and it's starting. It's auto-triggering. And you're trying to pull this off to stop it, and it's going. So it's auto-triggering because it's too sensitive. It doesn't take much effort at the mouthpiece for it to go off. Okay? So that's auto-triggering. It just keeps going. The other one is the rate control is on. So this is properly set, -1 to -2, but you have this apnea thing, like what we did with Bo earlier. You have it on, so if you didn't check that it's on, if you didn't check that it's on, it's just gonna go off. There you go. It's not even in his mouth. And then it goes off again. Okay, let's take a deep breath. Okay, and he's exhaling still. Don't breathe in. And it just goes on without him triggering it because this was on. But this needs to be off. Remember, it's only for apneic patients. Won't cycle off, system leak. You saw that with Bo earlier. He didn't have a good seal. So don't have a good seal with your mouth. It won't cycle off. It won't stop because it's not hitting that pressure. It could be also that the system leak could be somewhere here. So put it in your mouth and make a good seal. Make a good seal. Take a deep breath. Make a good seal. Are you blowing out?
Yeah.
Oh, don't blow out.
Oh.
No, make a good seal.
It's gonna. It's gonna explode.